Hello and welcome to A Healthy Mind. I'm Dr. Cislina Grosser-Ledbetter, Director of Counseling and Student Development at the University of the District of Columbia, and your host. On today's edition, our issue is relationships and their perils. Joining me to discuss this topic is Dr. Michael Wannon. Dr. Wannon received his PhD in clinical psychology from the University of Rochester and later joined the faculty of the Department of Psychiatry at the university's Strong Memorial Hospital. His clinical and research interests focus on the interface of personality development with coupling and couples therapy. When he returned to his hometown in DC in 1994, he initially worked at the Catholic University and then later went into full-time private practice in Chevy Chase, Maryland. In addition to his clinical work, Dr. Wannon is a faculty member and the chair of the Couples Training Program of the Institute of Contemporary Psychotherapy and Psychoanalysis. This is a training program for therapists who seek expertise in couples therapy. Welcome, Dr. Wannon.
Thank you.
That's a lot.
That's a lot.
That's a mouthful.
Mouthful.
It is. And so I know you see couples all the time, and couples have lots and lots of great times, but they also experience a lot of challenges. And so we're going to be talking a little bit more about the perils and the challenges side, because while we've done relationships before, this is kind of an interesting twist on them. And what I'm curious about is, what are some of the most common issues that couples come to you with? Like, what are the problems that they show up with at your door?
So I guess there's two ways to think about the problems. One is, what the stated problem, the content problem. And that could be that they're struggling around issues that have to do with parenting differences or financial differences, issues around their sexual life, the stress of a loss or a transition.
Mm-hmm. Is the most common? Is there a common theme? Like, do most of them show up with? Because I think money, or communication, because he doesn't talk to me or she doesn't talk to me, or sex.
Yeah. Well, the communication piece was you took it away. You're a step ahead, which is that all these content areas, fundamentally, the problem that really has somebody maybe seek therapy, or even if they're not seeking therapy, a problem that becomes a real issue of conflict, of struggle within a couple, has not to do with the content, because that's part of living as a couple. It has to do with the fact that the communication process is not allowing the couple to find some level of compromise between them. Mm-hmm. And that may seem very obvious, of course, right? That the couple can't communicate, or the couple will say, we can't communicate through these problems. What's less obvious is, why is that?
So there's a block. It's not the issue. Maybe it is the issue, but it's not necessarily the sex. Although I'm sure men and women might differ on that point.
Yeah, we'll talk about that.
Or it's not the bank account necessarily.
Right.
It's, you can't communicate with me what I need. I can't communicate with you. So there's a disconnect going on.
That's right. There's a disconnect, and there's an inability to fundamentally bridge your perspective and my perspective to a compromise. Mm-hmm. Now, almost any thinking person will say, well, that's obvious, of course. There needs to be good communication and there needs to be compromise. But in reality, since we have a divorce rate that hovers between 48 and 53%, and even those 50% who don't divorce, about a third of them admit that they have very unsatisfying relationships.
That is really high.
Yeah, that's very high.
That's like half are headed towards divorce at any point, right? And then almost half of the ones that are still married are miserable. Right.
It basically comes out that if you marry, there's about a 1/3 chance that in your long-term relationship, you're going to say that you have a satisfying relationship. Not a relationship that is without conflict or bumps, but a satisfying relationship. And the biggest predictor of that is that when you reach those inevitable differences, whether they're about parenting, sex, finances, loss, there will be a way to communicate that will feel intimate, that will feel respectful, there will be an equality of power and control, and we will find a compromise.
Mm-hmm. So what you're saying, I'm going to state this, The biggest predictor of satisfaction in the relationship is the ability to be able to talk about it.
That's right.
In a respectful way.
In a respectful, in an intimate
way.
In an intimate way.
Mm-hmm.
In an intimate way. A lot of people say, what does it mean? That word intimacy is thrown around a lot, and obviously because I do this all the time and train, I think about that, and when I think about intimacy, I think about the experience of being authentic.
Right.
Okay? So if we're talking in an intimate way, I'm not just talking with you, I'm telling you things that are really authentic, that are really personal, that are really at the core of me, and I trust that you really understand it, even if you don't fully agree.
Right, right.
Okay.
And so, you said a word that I think is really, really important to highlight, and that is trust. It has to be there from the beginning. And if you don't have the trust, or you don't find a way to build it, because, you kind of marry somebody and then you both end up growing, changing.
Mm-hmm.
So it's, it's not that, oh, he changed or she changed, you'll both change.
Mm-hmm.
But if you trust along the way, then it sounds like to me that there would be a greater chance that communication would continue.
Yeah, that makes a lot of sense.
Mm-hmm.
Certainly, if you start a marriage or a relationship and there's basic mistrust, that's a really bad sign. But the reality is that most people don't start that way.
They don't start which way?
They don't start with mistrust.
With mistrust.
They start here. This is not universal,
Mm-hmm.
but most couples, this is what they report. They report that they are in love, that they are sexually attracted,
Mm-hmm.
that they have admiration and respect for the other person,
Mm-hmm.
and that they trust the other person. And most couples run into very, very difficult problems. So actually, how we begin is actually not a good predictor. Wow. A better way to think about it is that the problems are inevitable, and to think about them as you're not going to necessarily experience those problems in the beginning of a relationship. Right. Because you don't have the stress of children, of the same financial demands, of aging, of health, of change. And so you have inevitable stressors and differences that occur at this point in development you don't really have here. Mm-hmm. And when you have them here, this is where the two individuals are really challenged mm-hmm. to talk in a way that couples need to talk in order to get through these points of differences and really feel more intimate as opposed to more distant and more hopeless.
And so let's talk about that trust piece, that it's not if, it's when. So you're going to hit a bump.
That's right. It's not if, that's perfectly put. I like the way you did that. Exactly.
Yeah, that's good, right?
Yeah. It's not if, it's when.
It's not if, it's when.
Exactly.
And so when there may be a breach in trust, we'll put it that way, when there is a breach in trust, whether it's you completely wrecked the bank account and I can't trust you because I've got to pay the mortgage out of it, or you completely went out and you had an affair. What happens when someone breaches trust? How do you deal with couples that come in and that there is a complete breach in the trust? Because that's a big deal.
It's a very big deal, and it's also very common, especially if we're talking about affairs.
Very common? Like how common?
Yeah, well, it's interesting. There's a little bit of controversy about how common, but there are lots of different people who've done studies on this. The most conservative estimates is that a man in an ongoing marriage is going to, why you smile?
No, say it.
Well, is going to stray out of the relationship. The most conservative is 20-25% of men. The statistics are all the way up to 60.
Wow, yeah.
Okay, and for women, the most conservative is about 12 to 15, with all the way up to 50.
Wow.
So, and these differences in terms of the studies have to do with, the methodology that they use mm-hmm. to ask recipients. But it's safe to say that we're probably looking at least 1/3 of men, and probably higher, and at least 1/4 of women.
Wow. And so, and we're going to get back to that question about the what the presenting issues, but do you have a theory as to why so much infidelity exists in, I'm going to say men to pick on men, mm-hmm. but we can say both genders, why mm-hmm. there's so much infidelity?
Yeah, and
because you kind of just said men cheat more than women. right?
They do cheat more than women,
Yeah.
and they cheat for different reasons than women.
Okay.
There is actually a difference in what most, and again, this is not specific to a particular man or woman, but the trends
Sure.
are pretty significantly different. Men cheat for different reasons than women tend to cheat.
So why do they cheat?
Okay, so for the typical pattern, there really are two kinds of pattern. One is back to you, there isn't trust in the beginning. Okay, there is a smaller percentage of couples who meet where that you've married somebody who you've made a bad choice.
But you said there isn't trust in the beginning. What does that mean?
So that's the smaller percentage. So maybe a woman marries a man who's kind of a philanderer, somebody who doesn't really take a vow or fidelity very seriously. By the way, when I speak to women like that, they tend to tell me that they knew that. But that's the minority.
Okay.
That's the minority. The majority, again, of couples again, feel that trust, they feel that fidelity, they expect things to go well.
Right.
What ends up happening a lot of times is when these relationship issues we were talking about, right? The feeling that the intimacy is getting more and more diluted, more and more distant the couple is. You know, I can't, let's be the male. I know, I can't talk to her about this. Every time we talk, we're in a fight. There is no sex going on in the relationship. All I hear is criticism. Pretty soon the relationship becomes a source of diminishment of self-esteem for the man. And the one pattern of infidelity that's true for a lot of men that they report is that when they have opportunities with other women where they feel some sort of admiration, some sort of appreciation of them, some sort of interest in them, there's a really stark contrast between what they're feeling at home and in this relationship.
So maybe that explains why a lot of men have relationships with their secretaries.
I
mean, I'm making a huge leap here. I recognize that. But their assistants or their secretaries, you hear a lot of that. It's not just on TV, right?
No.
You see women, you know, catching their husbands at the office. I mean, they dramatize it.
Right.
But I am sure that you know, those are the people in their lives who are, you know,
attentive.
Affirming them.
Exactly.
And making them feel productive.
Exactly.
And keeping the calendar.
Exactly.
And you can do no wrong.
Exactly. And you're making a really good point that it's not all about lust and attraction, that there's something that is being lost now in the relationship around admiration and appreciation that makes the man kind of vulnerable to that. Now, having said that, some men will have that experience. They will feel turned on by somebody at their work or in a party or something. They won't act on it, though. Right. They may actually initiate therapy, or they may even initiate a separation.
Mm-hmm. Yeah, but you know what? I mean, I'm kind of glad you said that, because it's okay to be turned on.
That's right. That's right.
It's okay to have a desire for another person.
Of course.
You know,
of course.
I don't know if having a sustained, ongoing desire is okay, but you just kind of mentioned you see somebody at a party, you think they're attractive. That's not a problem necessarily, and it's not necessarily a predictor that there's going to be one.
That's right. Absolutely not. So then there's the second piece, which has to do, and this is what I always say to couples, which is that fundamentally when somebody cheats, mm-hmm. it's never because of something the other person did or didn't do. It's really because there is, within the individual, there is a vulnerability to be able to deal with that loneliness or what they're not getting by acting out in this way. In other words, there are some people who are suffering in a relationship, but because of their own value system, they won't act on it by cheating. They might be very, very tempted.
Right.
And there's, like you said, there's nothing abnormal about that.
Right.
But they have a clarity about their relationship to themselves that they don't want to do that. Mm. So that's another piece that has to be explored. When somebody does cheat, when a couple is trying to regain a trust from an infidelity, right. which is extremely difficult yes. but can be done, the person who cheats has to do the work of understanding what was it within themselves that allowed them to take this step, even though they were unhappy. Clearly there are all kinds right. of things that made them unhappy, but they could have dealt with that unhappiness again, by either initiating a therapy or initiating a separation. You know, they could have done something that would have still stayed within the vow of the marriage.
Right, other than breaching trust.
Right.
Or ending up in bed with someone else.
Right.
Right.
Now,
So
women do this too.
right, so women do this too. Equal opportunity. So you talked about the men feeling unappreciated, not feeling affirmed, feeling like there's a separation in a relationship, and that's primarily why they stray.
That's a very big part of why they stray.
That's a very big part.
Very
For
big.
women.
Even more so those factors. So even more so the factors of feeling a lack of emotional intimacy, feeling a lack of equality and respect, feeling not special. Even more so, women who have, and that's why, by the way, when women do have affairs, they are more likely to have affairs with men who they're really involved with, who they're working with pretty closely.
Oh, really?
Oh yeah, yeah. That's the most common, or someone in their social circle, someone they feel a relationship with, someone that they feel an emotional relationship with. They're not as likely. Again, these are generalizations, but they bear out. They're not as likely to have a one-night stand or to have sex just to validate sexual desirability.
Right.
Whereas men who are in a relationship where perhaps the sex has really shut down, they will sometimes do that.
Just for the sex.
Just for the validation.
Just for the validation. So it's not really about the sex.
It's
both.
It's both. It's not, or maybe, yeah, it's more, it's just, it's
You're
not,
gonna get in trouble here.
yeah, it's more about, I would never say it's
That's
not
right.
about the sex, but it's not just about the sex.
Couldn't they just turn on porn?
Yes, and
Not that I'm saying they should, because I
Yes.
know that's also a problem in
They-
relationships.
they could, but going back to the emotional part, we're not going to get that in porn, right?
Right.
Right. So because again, in the early part of the relationship, I mean, think about it in terms of your own relationship or anybody who's listening. When we're in love in that early part of the relationship, it's certainly not all about sex.
Right.
It's partly, but it's really about the feeling that you have somebody who adores you and who you adore, someone who admires and you admire. This is a psychic need in personality. It never goes away.
Yeah.
And it never goes away. It's a psychic need. Without it, we are prone to depression and we're prone to anxiety.
So the intimacy doesn't go away. That feeling of butterflies and what we call erotic love or eros, that ebbs and flows.
That ebbs and flows.
But the intimacy, the need for the intimacy
Never
goes away.
No.
And that's a really important distinction.
And so back to communication. So
Yeah.
now we have this couple that's doing the intimacy fairly well.
Yeah.
Okay? And then they hit a point in their development, as every couple would. Let's say they have young children. And
Lord knows that's an intimacy killer.
Exactly. Okay, and now let's say that the woman who is taking care of these kids and is feeling kind of depleted, is her sex drive is naturally,
She's nursing.
she's nursing, or even past that.
Right.
Her sex drive is less than it was.
That's right.
His, who's more oriented towards visual cues, is just as strong. And not only is there a tension around sex, but most importantly, if they were to talk about it, and you would be amazed at how many couples don't talk about it very explicitly, if they were to talk about it, most couples like that would begin to describe a talk that would unravel into a lot of conflict, a lot of hurtful comments.
Whose fault it is.
Whose fault it is, shaming comments about one or the other. And pretty soon, this very important area of intimacy can't really be talked about towards something that feels like an intimate compromise. It can't. And so it begins to be something that fades or that gets diluted in the relationship. Once that happens, there's an important source of intimacy that is being deprived in the relationship.
So it's kind of like the longer you go without being intimate, the harder it is to go back, or it's hard to go back because I don't want to talk to him, he doesn't want to talk to me. Well, if you're going to be like that, then I'm not going to talk to you, and then it just goes on and on and on. And then you hear about how it just becomes very commonplace
That's right.
to just coexist.
Incredibly commonplace.
Yeah,
I mean, I don't think that couples. I know that couples don't talk to each other about how commonplace it is. I wish they did. I always tell people that I really want them to try to open up and talk to other couples, because the sense of isolation that this is happening in our relationship, it's worse in our relationship. It's an extraordinarily common problem.
But couples don't like to tell. It's kind of like,
Yeah.
I know black couples don't, because we don't want to tell our business,
Yeah.
It's like, no, this stuff is private. Don't tell your friends about our problems.
Yeah.
And, and vice versa. So I don't know whether
I
you
think
have
that's
thoughts-
true.
Yeah.
Of white couples, I think it's
yeah,
true.
all of us, the whole rainbow. We're
Yeah.
just like sitting in our
Yeah.
corners struggling with different issues, and nobody's talking.
That's right.
Except in your friends circle where you have groups
Yeah.
of couples talking, which I think is fascinating. But first I want to talk about how you break the cycle. How do you get couples to talk? Once they have hit that, we're going to call it point of no return, although we know that there is, because you're going to tell us about it. But how do you get past that?
Okay, so we have this. What's that?
No, go ahead.
Okay, we have this not only common, but we would call it inevitable.
Yes.
Inevitable bumps in a relationship.
That's right.
Sometimes these bumps can feel massive. Sometimes they can again lead to divorce and infidelity. But one thing that they have in common is if you look at a couple and you ask them to talk about what this issue is, whether it's their sex life or the way they're parenting their child or their
Sure.
finances.
Mm-hmm.
If I said to you, let's just put them over there and have them talk to each other about this, you or any non-trained person, right? You're trained, but any lay person who looked at the couple talking about that problem, they would have a 90% predictive rate that this couple is in trouble.
Really?
Yeah. In other words, we don't have to be trained, we don't have to have a PhD to know what poor communication looks like.
Right.
Okay?
Absolutely.
And it's very, very predictive. Okay, it's very predictive. There have been studies that have shown that you can look at a couple in the first year of marriage dealing with a particular area of crisis, and you can predict with 80% accuracy even their divorce rate.
Get out of here.
Yeah.
What? You
But-
can predict with a great, reasonable certainty within how many months?
Within the first year.
Within the first year, whether a couple will make it based on how they communicate.
Yeah,
That's
that
really good.
it's somewhat controversial.
No,
there
yeah,
have been there have been some counter studies to it.
Yeah.
But no one disagrees. No one disagrees that looking at the couple actually talking through an area of conflict tells you an enormous amount about their ability to surmount it. Now, the thing is, when you look at that, what you will see is that here's the qualities that a couple that is not communicating through this area. One is they have enormous difficulty being empathic. Okay, they have enormous difficulty. You're telling me something that you don't like about me, and I'm telling you something that I don't like about you. And when you're telling me, I cannot empathize with you.
Yeah.
I cannot respond to you in a way that makes you feel like at least I get it.
Right.
As soon
That
as you
is so
tell me,
important.
as soon as you tell me, I want to debate it. As soon as you tell me I'm defensive. As soon as you tell me I want to make the point that I have to tell you.
Right.
Okay.
So it's kind of like guys that say, yeah, the two most famous words in my vocabulary now are yes, dear. It's kind of like that, and I know I'm kind of watering it down and reducing it to the lowest common denominator. But the same thing applies for women. The ability to just say, you're right.
Right.
Can we? Yeah, I get it. I really, really get it. I'm sorry. We can move forward. Sort of.
Sort of.
Yeah,
Yeah.
yeah.
I mean, that's good.
Yeah.
It's good. It's not empathy, but it's good.
Not empathy.
No,
okay.
it's not empathy.
Okay.
It's not empathy because some responding kind of like that generally leaves. That's better than defensive and arguing. Yeah.
It's better than that.
But generally, what it does is it leaves the other person feeling like, you're just trying to kind of get this over with.
Well, I mean, I would be sincere when I said it. I'm just giving you an example. It would be more empathic. It
Yeah.
was just like an example of how a beginning.
A beginning it's a good way to put it.
A beginning.
Yeah.
Yeah.
And it's amazing how even that kind of beginning is so difficult for couples. The defensiveness and an inability to be empathic is almost universal.
The inability?
Yeah, the inability is almost universal. And to understand why that is, to understand why that is that, first of all, it's kind of remarkable. Many of us actually don't see. This is a perpetual cycle.
Yes.
Many of us are not raised in families, and we're not raised by parents who communicated that way, either with each other or with us. So it's not necessarily internal to us.
It's a learned skill.
It's a learned skill. And the more we learn it and the more we do it with our spouse, the more our children, and not only with our spouse, but with our children, the more our children have that skill inside of them.
Right.
You know, if I had all the time in the world, and I always think about doing this when I cut down on my practice, this is the kind of thing that I would bring into the school system.
The children. Oh, yes, empathy.
Yes.
You know what? I think they do it in Montessori.
Yes.
Yeah. I'll have one empathic child.
Yeah.
I'll have one. Right?
Oh, that's good. Oh, she's in Montessori?
Yeah, one in
good for you.
Montessori.
Great program.
Right.
Great
Yeah,
program.
it is. But thank you so much. I think we might need to do a part 2 because this
Okay.
is really, really good stuff. But I
Okay.
haven't even gotten to the juicy stuff. So
Okay.
I'd like to thank Dr. Michael Wannon for being my guest. If you would like more information about the topics we discussed, you may contact Dr. Wannon at 5454 Wisconsin Avenue, number 1215, Chevy Chase, Maryland, or call him at 301-951-9488. If you would like to reach me, you can follow us on YouTube and Facebook at A Healthy Mind UDC, or visit me on Twitter at Dr. Sis. I'm Dr. Cislina Grosser-Ledbetter. Thank you for watching. I'll see you next time on A Healthy Mind. That was great.
Right.